Welcome to EMS Office Hours. This is Jim Hoffman, and these are your Monday Minutes. Thanks for joining me today, guys. We're going to continue on with the EMS Quick Study Tips here, and we're going into drowning, or actually drowning versus near drowning, right? So drowning is that death by asphyxiation, right? We can't do anything about that. They're already dead. So we're focusing more on the near drowning, where we can actually reverse it, okay? The process of drowning or that immersion is interrupted, or we can actually reverse it, okay? Now, of course, drugs and alcohol are usually involved in these, and about 35 to up to even 75% of drownings are drugs and alcohol are involved. They can drown in lakes, ponds, the ocean, or even backyard pools. And males are about 5 to 8 times more likely to drown, and older, younger, doesn't really make a difference for that. Usually they're on one side or the other, right? The younger version or the older version are also more likely to have a higher risk factor. Before I get into some of the signs and symptoms that might seem obvious to you, I want to just talk a little bit about why this stuff is important, right? I often talk about the key stuff for this is stuff you're going to see on exams, right? But it's not just for exams. While the information's there to help you pass the exams, it's also there to build your knowledge base, let you make better clinical decisions, give better patient reports, and interact more efficiently with other healthcare providers. Okay, so talking again about near drowning, what are some of these signs and symptoms? Well, we talk about things like the progressive shortness of breath, wheezing, tachycardia, cyanosis, chest pain, even mental confusion, right, altered mental status. Patients can also be, of course, in coma, respiratory, or even cardiac arrest, right, the actual drowning part, where they've already been in the water for too long, right? But how do we treat these patients? Basically, what we're doing is lots of stabilization, right? Stabilizing the neck, of course, if we feel some sort of trauma that's involved, but also BLS. We can actually start an airway in the water. We can even start CPR in the water if you have the appropriate equipment there, like a CPR board or something like that, to go ahead and start CPR on these patients, right? And of course, the EKG, IV as needed. Depending upon your local protocols, it might also include drug therapy. It might include rewarming, right? Follow your local guidelines, but these are sort of your basic things. A lot of it's supportive, a lot of it's your ABCs or your CBAs, right, to go ahead and treat these types of patients. Now, it's good to know for exams and stuff too, the types of drowning. Basically, there's three. There's dry, wet, and secondary. But there's also issues with thinking about too when talking about either seawater drowning or freshwater drowning. So your dry drowning is at 10 to 20% where you get that spasm, that laryngeal spasm, and they call it dry because your airway gets closed up and the water does not get in, but yet you still drown because you're not getting the oxygen, right? 80 to 90% is where the fluid does get in. You don't have those spasms, and the fluid gets in, fills the lungs, and then that's the actual wet drowning. And then the secondary type of drowning, right? This is those recurrence of fluid in the lungs, things like pulmonary edema or aspiration pneumonia. Okay, and this sometimes you'll see this after a patient successfully recovers from a drowning, and it can be a few minutes after they recover, or even a few days later. Okay, you up to 4 days later. Okay, there's some stuff to think about when you see those types of drowning. You might see that question on an exam: what are the 3 types of drowning? And it's dry, wet, and secondary. Now we talk about seawater, right? This can actually cause an influx of hypotonic serum, okay, in blood. Then it can't exchange. You can't exchange O2 and CO2 for the seawater. Okay, now freshwater drownings, that actually causes more of a washout of surfactant, and your lungs end up losing their elasticity. Okay, so just some things to keep in mind when you're treating these patients. Also, when you're taking your exam, to know the difference between the different water types and the different types of drowning themselves. Now, I want to talk a little bit about diving accidents, guys, just to kind of get into this a little bit and kind of round this off, okay? But we talk about dry diving accidents. This is those. It's good to know the pressure increases about 1 pound per square inch, or psi, with every 2 feet that you go deep into the water, right? So divers in particular must take pressurized air in scuba gear so that the lungs don't actually collapse. Okay, now your air embolism, this is where the divers must exhale on the way up. I'm sure you've heard of this before, right? They have to kind of come up slowly and exhale on the way up, or the volume of gas that ends up getting trapped, okay, the air kind of gets trapped in the lungs and ends up expanding, right? And it's, keep in mind, it's easier to hold your breath underwater because that oxygen is under pressure and more gets into the cells and all. But sometimes if you hold your breath underwater, or when you are ascending, the drop in pressure can stop feeding the tissues, okay, and at the same rate you can end up actually blacking out from that, okay. Some of the signs and symptoms I have right here on the right hand side, you can have things like pink frothy sputum, shortness of breath, vertigo, or even seizures, okay. This is all for air embolism. So what are the treatments? Again, it's kind of similar. A lot of it's supportive. It's positioning the patient. It's oxygen. And it's a lot of times, too, they end up going to that hyperbaric chamber to go ahead and help that pressurization kind of equalize and get it back to where it needs to be. Now, one other thing, real quick for a wrap up today, guys, is decompression sickness, or the bends. I'm sure you've heard of this before as well, right? That's the nitrogen that dissolves into the tissue under that high pressure we just talked about, and it gets released into the bloodstream in the form of bubbles, right? And again, this happens when the diver is coming up too rapidly. Okay, a lot of times this ends up happening because of repeat diving. The divers go in the water more than once in, let's say, a 12-hour period. Okay, so they're more susceptible to that. So some of the signs and symptoms, you're going to see the blotchy, sort of red rash, pain in the joints, which is a big one, dizziness, shortness of breath as well. Okay. Treatment, again, ends up being more supportive, right? Oxygen IV, positioning, left side, left lateral recumbent, you might want to say, right? Because the air can trap in the heart as well. So that's kind of trying to preventing that from happening. And again, the hyperbaric chamber. Okay, another way. Again, this is something these patients more than likely will need the hyperbaric chamber to get the gases where they need to be. Okay, guys, I don't want to go on too much with this. We're going to wrap this up again next week and kind of wrap it up with the high altitude sickness, and we're going to kind of wrap up with that video and talk a little bit about that. So, guys, please go ahead and engage with me. Meet me on social media. You can get me on Twitter or on Instagram. On both of those, I am at EMS Safe. Or you can go ahead and hook up with me on Facebook as well. It's facebook.com/the EMS Professional. I do a little something different on all these channels, and you interact with the followers that I have there. Okay, guys, if you have some Monday minutes of your own, I'd love to go ahead and include them in upcoming videos and upcoming sessions. Send me your ideas for your own Monday minutes. Okay, you can send an email at contact@emsofficehours.com, or right here on the blog as well at emsofficehours.com. You can just post below and let me know something you might want to see here on the Monday minutes. Okay, so as I build up these videos for you, I'll take a break from these quick study tips and go ahead and give you something that's more specific to what you're looking for and something that you actually want to see. All right, guys, that's it for me. Again, any questions, comments, concerns, this is the email. It's contact@emsofficehours.com. Until next time, guys, as always, I am Jim Hoffman. Stay safe.